longtime doctor and everybody's favorite doctor, the pioneer of private healthcare in India, and many other revolutionary aspects of healthcare, Dr. Pratap Reddy. Dr. Reddy, it's such a pleasure and privilege to have you with us. Thank you for agreeing. At a time when Chennai is also seeing a rise in cases, I'm sure you're extremely busy, but it's really good of you to join us. Um,
I-
yes,
I'm very happy to be here, and especially seeing Prabhu Chawla. I know him for more than 40 years, and I've also known how he has grown in his profession.
right.
And to be one of the foremost as a journalist, today the foremost editor, uh, analyst, and whatever. He's excelled himself in this, and we are proud of that.
Great. And a lot of it, as we just discovered, is thanks to you. He gives you credit for it, for preventing, for diagnosing his condition early. Let's start with that, doctor. You know, how important has COVID made us realize how preventive medicine is really the key? You know, building your immunity, building your health is really the key to saving yourself from things like this.
I think first, you mentioned COVID.
Yeah,
This is the word which has panicked everybody around the world.
right.
It started in China. At come February, March, it spread around the world. India saw, the growth in February. March, we felt the disease, and today, it is on the minds of every single citizen around the world.
Right,
Either they are affected of COVID or they are afraid of COVID.
right,
I think that panic situation has made more tremendous than its mortality.
right,
Uh, First, this is a virus. This is a virus called coronavirus. Started in China way back in November, December. They did not give the full uh, face of how it grew.
right,
They contained it in one province. But what's surprising is, whatever we have done, I think some of our governments, the Indian government, should be credited for the early lockdown. Even with the early lockdown, the disease has spread tremendously across the world. Some countries like US, most advanced countries like US, their mortality is high, their affection rate is very, very high. So I think this is what we are now facing. We still don't have a answer how to cure this.
right,
Any disease, if we say that we have conquered it, we should be able to say that we have found a medicine to arrest the disease or find a vaccine to prevent the disease. So this is what happened with HIV, with other flu virus, uh, HIV, and all of the things. But unfortunately, so far, many scientists are working across the world. Not one is able to say that it will be ready in the next few weeks, few months. No. We wish it happens.
right,
The second wish I have is, even if it's available in US, we can't afford that cost for all our people.
right,
What is use of vaccine? The vaccine is useful only if you can vaccinate large number of people.
yeah,
So they stop contaminating others.
right,
So if you give only for the 10-20% of the rich people, it costs 10-20,000. It's really not done anything for the country. So I only hope either Hyderabad or the Pune are among the people who are working very hard. If they are promising, if that comes out, and if it's like Poonawala's, he made it so cheap that it's nobody hesitated to take those
HIV drug, yeah,
drugs. I
yeah,
think vaccines.
vaccine,
I think that's what we need to make the whole difference. But as we see it today, it has suddenly come. I said, as far as I remember as a doctor, even as a child, the only horrible thing I remember is the World War
yeah,
when I was 10 years old. Afterwards, I have never seen as a doctor a disease, something like COVID, which has totally shaken up the whole world.
right,
Shaken up in the whole world means it's not only people, the professions, the business, the economy, everything has come to a standstill, which nothing ever before has ever done. Even during war, business went on. Everything was going on. Although there were expenses for the war, there were fatalities due to war.
Right.
But here there is fatality, but almost zero progress on the economic front. So I think this is where Corona is.
Yeah.
What we need in Corona is to wait for that day. Till that day, whatever they were advised, the WHO and our CSIR and the governments are advising us, keep ourselves safe. I think those three things we should keep very, very carefully.
Yeah.
Stay the distance, so wear a mask. Then when you want to sneeze or cough, use your elbow.
Right.
And if you keep away from a distance. Previously, we used to say 6 feet. Now they say this is probably works like an aerosol. So they're asking that the distance should be longer.
Right.
Doctor, I will Doctor, 1 minute, because you are saying something very interesting. That there is unnecessary, the fear which you are expressing, everybody is feared, everybody is paralyzed. Is it genuine or it is psychological?
Yeah. It is psychological fever because they are seeing and hearing. If you look at the media, we don't see anything other than that. From morning till evening, the pictures of how many affected, and, how people died, and fortunately that numbers are not high in our country, but at least they show other countries how deaths are happening, how they are crossing the marks from 2-digit to 3-digit to 4-digit to 5-digit. And this is where I think the panic is worse than the disease.
Doctor, are you saying that numbers being given out by media also is unjustified, the way they present the media figures? They are also inflating the figure, not inflating, they are exaggerating the impact of COVID by giving the top line figures rather than the lively figures.
I don't know. The analysis could have been better. It could have been a little more reassuring if they say the recovery rate in India is much higher.
Correct.
That gives people a little comfort. But it still don't take off. Then they hear yesterday, Amitabh Bachchan and his family is infected. Oh God, if he's affected, what about our poor families? So I think such things are making things a little more difficult to arrest the disease. But our effort should be continuously to do more and more tests and treat people in a systematic manner.
Doctor, you are saying something, you are saying about the prevention. It's irony that we wish Bachchan family all the well, they will come back home very fast. I know it. They have been fighting in the past, they have won battles. But this is irony there. The person who was advertising every day how to prevent it, got it. There's a tragedy somewhere. The person who was, like you are talking, wash your hands, keep a distance. I'm sure the family must be doing all that. It means there's something else which gets you somewhere. What is that? Because that's the fear which is unknown. Because I don't want to come to my office knowing that something may happen. Though it is a disease which I know can be defeated if you have a willpower. But since you surrender yourself, you die or you become victim of it. So how you prevent when the person who's preaching everybody how to prevent it gets it, that puts a much more fear in the mind of the people.
I think, as I said, this is what people got completely shaken up. The person who was advising people how to stay away from this disease, and when he got it and when his family got, people were shattered last night. I got so many calls, and our 24/7, we have an online call. I got the maximum calls yesterday. Is it true first? And second thing, how could he get if he is observing all the. So I think there is very difficult to know that other individual who is talking to or meeting who has the disease. Till it becomes well advanced. If he's not coughing, if he's not sneezing, we won't know. Even if he had temperature, we won't know that. So I think that is the fear. So the only way to prevent this disease is to eradicate the disease first.
Doctor, one thing I have not understood. He is asymptomatic. There's no symbol there. He's not coughing. He doesn't have a fear. He doesn't have a breathing problem. I'm not able to, as a doctor, you may be able to tell you. What then? How is COVID positive? What are the other signs of COVID positive then, which are not visible?
Now, first of all, it is a disease. Once you get the disease, that means if the germ entered into your system, it can, most often it is affecting the respiratory system, the lungs, the throat, the nasal cavity. This is the upper respiratory system symptoms it is showing. But it also affects every single organ. You know, and it aggravates the existing problem. This is where I think it's very, very important that people who have comorbidity, that means, you know, sometime later I'm going to talk about NCDs. If they have one of the NCDs, diabetes or heart or strokes or cancer or other infections like asthma, they are much more prone for this disease. The severity in them is high. That if they recover, the recovery is also longer. And the mortality figures comparatively is very high with people with comorbidity. This is where I think people with comorbidity should take care of themselves. The unfortunate thing is because of this fear, they lost touch completely with their doctor.
Yeah.
They forgot going to this. I'll give you a simple thing on heart disease. On New Year's Eve, we had about 20 to 30 in our group with acute MI, mostly below 40 years. In the last 4 months, we probably would have got only about 20 acute MIs. We have now slowly started seeing patients who have had the attack and survived, and the angiogram showing the block, and then we are doing the plastic or the surgery. But for a long time, they did not want to go out to step out the house. They were afraid to talk to the doctor, to tell them these symptoms because the doctor will say, come to them. Right. This is where and if they want to go to the hospital, the police stopped them and they didn't have a conveyance. Right. This is why Apollo announced. I announced in May, early May, when I heard one of my patients could not reach the hospital because he didn't have a conveyance. I announced saying all Apollo ambulances and Apollo cars will be available for anybody in the cities where our hospitals are there. It's free for them. Night and day, the ambulances and which are up to June. Now that this is not seeing end in June, I'm going to say it should be free for them. Till October, they can call saying if they need for any emergency, they can call Apollo for an ambulance, 1066, or for a car. I think these are the reasons for which they did not come. And I think that is what has really contributed this huge problem, not to mitigate. We're not able to see a flat curve because more and more people with comorbidity are getting infected and reaching the hospitals. And even the morbidity figures, although India should be proud that our mortality figures are much lower than the rest of the world, it could be even lower if we had only looked after their comorbidity.
Doctor, may I quickly ask one question here? Do you think that our focus on non-communicable diseases over the years has led to this situation? Given that communicable diseases are now staring us in the face, do you think that our healthcare system was geared wrongly?
I'm happy for you ask that question about non-communicable diseases. I think this is one disease which actually means 5 problems.
Yeah.
Diabetes. Diabetes affects every single organ in our body, from head to foot. You can lose your sight, you can lose your smell, the heart can get affected, the kidneys can get affected, the liver can get affected, and neuritis. From head to foot, that's one disease which can affect any organ and to any severity. But to control it is very easy. First, obese people, even if they control their diet and do proper exercise, they don't need any medicine.
Right.
The second is there are very good medicines available for diabetes. Yeah, but that alone is not enough. You should do your diet, you should do your exercise, and take the appropriate amount of medicine. and it's well regulated. The diabetes, for example, we run the diabetic clinic.
Right.
Almost 90% of them are in good control. Well, in my village, there are 60,000 people whom I look after their health. In that, there are 17,000 diabetics. In 17,000 diabetics, when we took over, it was totally irregular. Not even 10% were in order.
Right.
Today, 95% of them are diabetes are well under control. But before medicine, they attend to their diet plus the exercise that we ask them to do, which I do myself.
Right.
I think this is very important. Similarly, the strokes. Strokes again, if you control your blood pressure, if you control your lipids, and then other physical activity and unnecessary stress, the strokes also will markedly decrease. The third, of course, is the most terrible thing. The cancer.
Cancer.
Almost it was called a death sentence before. I still remember I advised one of the famous political leaders. He was tested several times. They didn't answer what the problem was. He came to Chennai and asked him to have a checkup. In the checkup, we found out that he had a tumor in the right kidney. So when he came to, after finishing the test, I called him to my room and said, "You have a bad thing and a good thing. What should I tell? Tell the stupid bad thing first." I said, "You got cancer in the right kidney." Then said, "What is the good thing that you're going to say? How many days I live?" I said, "No, I'm going to say that you will be completely cured."
Right.
So I think
Doctor, one thing you have pointed this comorbidities, which is an example there, because a lot of people in India are suffering from other diseases.
Yeah.
Don't you think that comorbidities which are running into millions of people, they are the sitting duck for COVID victims, because most of the people have died. They have other diseases as well. Don't you think that we should be handling, instead of handling COVID for prevention or mortality, we should be handling more on these people who are heart patients, diabetes, lung patients? Don't you think that is being avoided now? Nobody's giving attention to those.
You are absolutely right, Prabhu Javla. You're right. You put right at the point. WHO, World Economic Forum first, previous decade, between 14 and 15, they announced that next decade, that is the second decade of 20th century, we'll see these NCDs grow enormously.
Right.
Almost at the end of the decade, they said 80% of the deaths will be from NCDs. 80% of the deaths will be from NCDs. But what are the NCDs? I told you, the 5 things.
Yeah.
And they have also said that the cost burden for the World Economic Forum said the cost burden for the world will be $30 trillion. And if you for India, it is going to be $4 trillion. $4 trillion by 2020 is going to be 50% of the GDP. All that we are all asking the government is that our GDP on healthcare should go up. Government should spend anywhere from 3 to 5%. Public should spend 5 to 7%. Then 10% at least. If we spend, we can enjoy good health. They don't understand the reality of, if you control our comorbidities, the NCDs, the advantage for the country, again, World Economic Forum has put it, Harvard study has also pointed out saying the GDP growth will be 15% if you remove these NCDs. Burden of NCDs if it is removed. Because why we are stressing so much on NCDs? Because they are all preventable.
Right.
And especially with today's, when Prabhu Chawla had that checkup those days, I called it master checkup. That was the first checkup in the world when we started. Today, with advanced tools that are available with us, with artificial intelligence available with us, and because we had done these numbers, we have done over 22 million health checkups. Because of this, and Government of India also gave us a stamp for the health checkups that we have done, the largest number in the world. Using artificial intelligence, we have never made a precise health check. It is individualized, personalized, precise health check, which suppose I take blood from 5 people for a checkup, the test done on them will be totally different because artificial intelligence will say from your history and from your physical findings, what exactly need to be checked. So with this, we can find out the state of his health. And if we can find the state of his health, we can completely moderate it. I told you all the 5 diseases, including cancer, is today, 3 years ago, when we had the international conference, more than 200 international faculty were there, more than 2,000 delegates were there. In there, they announced saying, cancer is conquerable. Yes. That is the symbol we use on our cancer hospital today. But last conference, when we inaugurated our proton center, when we have one of the finest proton hospitals in the world, in Chennai. They at the inaugurations of that time, they had a conference and then said cancer is now curable. But they added the word, if detected early.
Right.
If you detect cancers early, stage 1, stage 2, again I go back to my village. I hope Prabhu Jawala comes one day to my village and sees how a village can be healthy. That's in that 60,000 people, I say there's no cancer. It's not that there's no cancer. We detect it early. We detect them at stage 1, stage 2. So they are operated and cured. So they're living a normal life. But in the beginning, when we took them 7 years ago, we found 6 cancers.
Right.
But it was too late.
Right.
Today, after regularly checking them up, pick up early enough and do this. So NCDs has a great role to play in human health, in the global health, and in the national health. In the national health, because the people will be healthy, their productivity will be much better. Every corporate must realize this, that the corporate must say, if I keep my people healthy, their productivity will be much higher. So I think, and they've also given the figure, people are healthy by preventing disease, the GDP growth will be more than 15%. So if our GDP is 10, it grows another 1.5% by spending so little, and so little time.
Doctor, I'll just interrupt you, sorry here. You have spoken about 3 to 5% of GDP should be spent on healthcare. They are not spending on education also. India has been much far behind on healthcare. But you are the first pioneer person in the country to start insurance-linked medical in the early 80s. And it has not progressed that much, but later on private, the people have come and you are into insurance as well. But there is no indication that private sector in India is more profit-making rather than healthcare. They are caring for their own health rather than the general care. That is the allegation which is happening, that private care, healthcare is becoming very, very expensive, keeping the people middle level or poor fellow out of the private care, and the public healthcare is very poor. So how do you resolve this issue? And when the allegation against the private sector?
I think you spoke like all other people. So I'm not surprised. Blaming saying private healthcare is very expensive. Nobody else tells. I told this example. If you have coffee in a 3-star hotel, it's 5 rupees. If you go to a 2-star hotel, it's 15 rupees. In a 5-star, it's 150 rupees. Have you ever questioned that? So what I mean to say is the hospitals, the primary hospital, the secondary hospital, the tertiary care hospital, the quaternary care hospital, all have certain amount of additional infrastructure and expenditure to look after this expenditure. So for example, if you are certified to NABH, there is a certain expense that you must do to maintain yourself as the conditions that are laid. What are NABH rules? To see that the patients are safe. And one of it is JCI. Apollo is the first one to Delhi. First JCI hospital. Last month in this COVID condition, they did a Zoom JCI certification of my proton hospital. And they said, this is phenomenal. First, because we did it all by Zoom, but your hospital is absolutely right on top. 1,600 points they have checked and said this looks with the standard. That is a cost. So I think what we need is to bring this cost. Again, the second point in this cost, when we're talking about COVID, some states have fixed a charge, and they fixed a charge for the room care for the intensive care. Intensive care, they said you charge 10,000 rupees. But they forgot that majority of the patients in intensive care have other comorbidities. You must treat them for the other comorbidities. So that is an additional expense. So
Doctor, I raised this question because you pointed out in the beginning that you are in your own village treating 60,000 people cancer patients and you are not charging anything from them. So there are examples which you have given yourself that if the private hospitals get into this kind of social care, it can be done. Why other private hospitals cannot adopt villages and small towns and do something like this, like you are doing?
No, it is not that people in India people are not doing. People are doing charitable. Previously, the whole entire healthcare in India, before we brought all those reforms, it was all looked after by the charitable hospitals and the government hospitals. As the technology started coming in, they found it difficult to fund the technology and the cost of using that technology. This is where I think Indian healthcare suddenly dropped to the levels. So thanks to whatever the reforms that we could bring in 80s, today, India can proudly say that we do the same thing as the best hospitals in the world. You mentioned anything. I started it because I lost a young man who couldn't afford to raise $50,000 to go to Dr. Denton Cooley, who was a personal friend of mine. Unfortunately, when I lost him, I thought to myself, how many more are going to die? So I told the then Prime Minister, Madam, there are only two people who can get health care today, the powerful and the rich. The rich guy, it doesn't matter what it costs. For the powerful guy, your Air India gives a free ticket and your embassy pays for him. What about all other people? And why should we depend? Even abroad, the Indian doctor is not an ordinary doctor. He was maintaining NHS before. Even today, 35 to 40% of the NHS people are Indian doctors. And in US too, several heads of the departments. Now, majority of the research wings, it is Indian doctors who are making a splendid difference. So I think having stayed there.
You have made it very interesting. Outside, they are all supported by the government, NHS, whatever. What kind of support do you expect from Indian doctors and Indian medical profession from the government, like the US, UK? Can you tell us that this is the government should do here or to support the system?
I think there are two things. First, I think we should say whatever we do, the scenario in healthcare is going to be post-COVID. We are not going to be seeing the same thing as before. Because number one, we are going to see health series in a bigger strength. Second thing, we are going to see the health index of each the individual is going to be a little poorer than before. Because he couldn't go to his exercises, he couldn't go for his long walks and things like that, so on and so forth. And probably get a little more in the house. So we are now talking about post-COVID healthcare. So here, number one, the individual must now be taught saying, what is good healthcare? And what is it, how do you do that? It's not a very troublesome thing, because in a day, people are saying, don't do 4 things, do three things. It's not bad. The 4 things that you should not do is the harmful thing like smoking, drinking, enormous food, and irregular diet and irregular exercise. These are the 4. And the do's are very simple, 3 things. First, find out your state of your health. Second, whatever your state of health, if you have any of those problems, you can get rid of it because there is a way for it. We now know we can diagnose 99% of the diseases, and when you diagnose, we know how to treat them. Because what we had in the previous century and even the previous decade, this decade has given us a huge advantage in healthcare. There are 4 major things that have come in healthcare. First is artificial intelligence. The second thing is automation. The third thing is 3D printing. Fourth, of course, is the robotics. These 4 things have made much more easier for medical fraternity to make diagnoses and then to correct them. So having these, I think India is suffering that 80% of the deaths from NCD, we could reverse that. By reversing it, what do they gain for the individual? because he is there available for him and his family. For the country, he is there as a productive person. The productivity of individual is there for his company or for the country.
Doctor, may I
And
ask? Yeah, sorry, Doctor, may I ask one thing? You've talked at the individual level. At the level of the state and the nation, you've said that we need to double our number of doctors, we need to triple the number of nurses, and we need to quadruple our number of paramedics. So this will require a complete reinvention of the medical education system. What do you propose, Doctor?
I think government, I propose four things.
Right.
You mentioned three things.
Right.
The fourth thing is we need to add 100,000 beds per year.
Right.
How do we do to see doctors with great difficulty? They're taking it up from 50, 75, 100, now to 250. But the nurses, they should have doubled the nurses as a strength. Instead, they took with great difficulty 50 to 75 to 100. So there are 250 doctors in our medical colleges and only 100 nursing students.
Right.
I wish that also at least makes 250, if not 350. That will be number one. To regulate is very easy, and it is no additional expenditure for the government.
What do they have to do for that?
Just pass a law.
Okay.
Now they formed the National Medical Council. National Medical Council must say that we are now increasing the numbers, like what they increase for medical colleges, and that you can admit now 250 students. Of course, they rate what are the conditions they should do. They should increase the number of beds, they should increase the faculty. By doing that, they can increase the number of students per year. So automatically our doctors, and they increase the number of colleges. The last 3-4 years, we are seeing the growth of colleges. That Apollo itself has 2 colleges. One in my district. I think it's a pride thing. I'm using the district hospital for the first time in the country as a medical college hospital.
Right.
It's a 300-bed hospital. About 100 patients used to come a day. 30-35 patients were admitted in so-called 300-bed hospital. But after we took it over, we completely redid the whole thing. Today it's a 750-bed hospital with a separate children and women wing, complete automation, and the attendance is nearly 2,000.
Doctor,
taking COVID patients there.
Doctor, that's interesting because there's a theory that you don't need more medical colleges, you just need more seats. Would you agree with that?
Along with both. I think we need to see why we need more beds is because for training that it is much more. That's why I said this, even the parliament they discussed and I think they passed, seeing my model in Chittor, we have 600 district hospitals.
Right.
If suppose they give 200 hospitals for medical colleges to maintain, they'll maintain it.
Right.
And with very little support to government, we're treating so many patients there. So patients get good treatment, number one. Second, the outcome will be more doctors, more nurses, more technologies are available. But it's not only for us. There's a huge advantage in training healthcare people. If we train them, India can use them. Other countries are desperate.
Hey, doctor, one thing I want to ask, doctor, you have been here for almost over 6 decades in medical profession. Who is responsible for underestimating the healthcare workers or doctor numbers in this country? Why so much of shortage? Because government control over NCI and NCI dictating who will teach what and where and how much number of acres required for a hospital. Why this underestimation on the part of Indian authority that we are now suffering for shortage of doctors, nurses, and everything else?
So, you are giving your duty to me. I can never question government. As a journalist, you can question the government.
But I'm asking you, is the government responsible?
We've been continuously talking about this, that this needs to be done. We've made several representations. What needs to be done to improve the education. What is the help that they can do for private healthcare to grow? Today, more than 2/3 of the people are getting private healthcare. There are odd guy whose bill is very high. Only that is shown. In 1,000 people, one person's bill is high. And Prabhu Chawla also said, private healthcare is very expensive. You forgot all the other 999 people, they'll come to you.
Expensive in the sense that, doctor, Doctor, I say,
30 lakhs.
doctor, when I say expensive, it's expensive because you spend so much money on getting a land which is very expensive. You spend so much money in getting machinery that is very expensive. But how to make it a five-star hotel? You're talking about hotel and hospital cannot be compared. I want the best medicine. But even the person, the driver, might also want the same thing because both are human beings. Since I can pay, he can't pay. He cannot be denied the best medicine in the country. So therefore, somebody must subsidize the good health care for him also. That is what I meant.
Good. I thank you for the clarification. But you know, five-star in a hotel and 7-star in a hospital is different. You know, they used to call me, you're a 5-star hospital. I said, no, don't say 5-star. I'm a 7-star hospital. Because 7 stars are 7 preventive things that we have done in infrastructure to keep up the quality that we give for people. We need excellent infrastructure, no infection first, no leakages anywhere, no electrical disturbances for all our very sensitive equipment. With all of these, that's what I call JCI, 1,600 parameters they measure how we are. And similarly in India, we help that NABH standardization. So when we do NABH, and if you don't do it, your cost of maintaining per bed is low. So this is where the costs are different. And when we want to do open heart surgeries, when we want to do heart transplant, liver transplant, and the kidney, all of these transplants, we need to have that very high infrastructure so that we don't hurt him.
See, doctor, you know, America, US, UK, everywhere, everybody goes to the same hospital. Even the Prime Minister of UK went to the same hospital where other people go. So how can we reach that? Ayushman, for example, they started 5 lakh rupees. Do you think it's enough for a lower middle class person to get a 7-star treatment in your hospital, for example?
First, I think Ayushman Bharat must compliment the government for having cared to give something for the lower 40% of the people. So I have my highest admiration for them. But then the only thing is they gave it an insurance, and the insurance payment per disease is very low. Probably for a nursing home, it more or less meets the needs. But if one wants to go to a secondary care hospital, that reimbursement will not be enough. So I think people who can afford a little should pay 500 rupees more and take an additional insurance. So from day one, I've been saying, we'll never know when we'll be sick. On that day when we're sick, it is the wife and the friends who help the individual to go to a good hospital and say how they can pay for the thing. So,
doctor, are you suggesting that they should increase some money in the Ayushman scheme to make it a little more attractive for the private hospitals to treat patients from the poor families?
I think yes, the insurance payment, if it's a little more high, better, it's nice. But the only thing is, even CGHS, ECHS, they take what's called L1 in government. L1, I have told this before. I went to one of the prime ministers and told him, my doctor after 35 years, 15 years of practice as a specialist, if he sees 15 patients, his take-home pay is less than your lower class. Immediately he called the cabinet secretary, and cabinet secretary called the DGHS, and DGHS put another tender. The tender again L1 came lower than the previous year. But every year we've been asked to pay the pay commission. So our administrative costs continuously increase. Our interest costs are continuously increasing. Now only it's decreasing. And similarly, our taxes started going up. So all of it, and we need to pay people to stay. Now the diesel and petrol is going up. I must pay my people in 14%, probably 15% increment every alternate year. So I think continuously costs are going up. That should be also taken care of in an automatic way. in for healthcare, if they do help us, and if healthcare plays an important role, it can play a very major role in the health of the nation. Whether it's private or public, I mean both. Public healthcare has shown great work this time in COVID era. So if
Doctor,
both
there
of
is
these
another,
combine together,
there is another issue, doctor. People are talking about too much of regulatory system in the country. You have ICMR, which takes many years, set around medicines, generic problems, they don't decide, pricing by the ministry, and you have got Medical Council of India, which delays everything, opening on new seats or giving new color. Don't you think these bodies should be abolished? Something else, much more practical should be there?
slowly they are
Abolish
done.
ICMR, abolish MCI.
MCI is abolished and put in new national
New, that is the
medical
same thing. It's in the new avatar, basically. Job is the same.
law. So, I agree, but I think what is needed is it should be taken when you take a decision, you must take it together. All the players,
With the stakeholders.
the stakeholders together to be called, and then only whatever we want will succeed. And the success in healthcare has two major advantages. Number one, keeping people alive and well, and second, improving the revenue of the country. Revenue by way of the GDP, revenue by way of international patients coming to India. Korea was nowhere. It was Thailand which was getting first medical tourism. Next, Korea went, and every single embassy of theirs took it as a challenge and advertised medical tourism in Korea. Then Malaysia, Singapore, and Germany. But in India, we were getting nearly 100 patients. The normal patient traveler to India spends about 2,000 rupees. But the medical traveler will spend $20,000. And along with it, we're talking more and more recognition of Indian systems of medicine, Ayush. If they also take that as a rehab thing, and they'll spend another 20,000 rupees there. So I think there's a tremendous value in promoting health tourism in the country. Number one, it will first increase our own healthcare systems. Number two, it will attract. Number three, it will get a good name for the country. I got treated in India. It's a great thing. When I started this proton center, one of the finest in the world, proton, which I have started in Chennai, the first 100 patients, 43 patients from overseas.
But,
So
but sir, in these COVID times, what is the future of health tourism with people so fearful of flying?
no,
Isn't that declining?
This of course, there is no way.
Yeah.
There's not even an airline to travel.
Yeah.
Now, the few people from within the country, they have to come to us. They are coming by air ambulance. Two of our patients came with permission with air ambulance. One came from Malaysia, again special permission, because he was an Indian. He was allowed. But,
See, doctor, do you think there is a need for improving the regulatory system in this country? Because there are so many allegations, right or wrong, I'm not getting into it. Then MNCs are deciding what medicine will be available here. People are putting pressure, what kind of, you can have vaccine or not, Indian vaccine or foreign vaccine. So don't you think that we must review our regulatory system and there should be autonomy? All stakeholder professionals should be more involved in the decision-making process than we are at the moment?
Yeah, I think the idea is excellent. I think if we do that, the results are going to be coming back to us. If we improve the systems and if the hospitals become better and more number of doctors and all are there, the advantage is automatically for the people in the country. You'll get better health for people. And as I said, better health also is going to increase the revenue for the government. So, and if they also encourage medical tourism, it's a huge point. And rightfully so, we can claim that spot because nowhere in India today, majority of the nurses are going for Philippines. How many they can send? They can send 5,000 nurses, 7,000 nurses. But India can send 100,000 nurses. If we train more, if we double, triple our nurses, we will have sufficient nurses for ourselves, sufficient doctors for ourselves. We can send them out of the country. So this again is indirect income plus a prestige for us. So when you go to UK, any institution go to UK or US, they respect you as Indian doctor. They respect us because our contribution to healthcare in those countries is very significant by Indian doctors and Indian nurses.
Doctor,
Doctor,
yeah, sorry.
just a minute.
Yeah.
The topic, for example, Kaveri and both of you suggested reimagining healthcare delivery. In that telemedicine part of the delivery system
Yeah.
also, because now it is happening post-COVID. Nobody wants, I don't want to go to the hospital for any test even. For example, if I have Norway, I used to do a test.
And home care,
And
Mr.
home care.
Chawla.
Yeah, that's right, both. For
Yeah.
example, I used to get my blood tests done for every 3 months. For 4 months, I have not done it. I am afraid
Right.
of the needle going into my system and I don't know what will happen. So how you prevent this kind of thing? Because I can't get my blood test done.
I'll send you Apollo diagnostic people. They will take it without any pain.
Because the question
And
is
give you
how
the-
you deliver this after
And give you the, no, they'll come home and take it and they'll give you the result onto your phone in 3 hours.
No, but they will put a needle in my system anyway to take the blood out.
It won't hurt you.
Anyway, what is the future? What is the future of home delivery of healthcare?
Yeah.
How do you
I
imagine?
think technology has made a very significant difference. You must have heard of Apollo 24/7,
Yeah.
which we started only about 6-8 weeks now. Since we started, we never thought of COVID, but that was getting prepared. So we launched it in mid-February. Already more than 3 million people have used it. And along with it, we also launched telemedicine. Telemedicine, we are the first in the world to have started the satellite telemedicine. Way back in 2002, when Bill Clinton, then President of the United States, when he visited India, I connected my village hospital with all Apollo hospitals, and he watched it near the function, and he saw one of the girls, a 13-year-old girl, being examined by from my village, and the doctor is at Hyderabad. The doctor told the mother of the child, saying, "Your daughter is a hole in the heart. During vacation, send the child to us. We'll fix it, and when the school reopens, she can go back." Then he added another word which completely shook up the president. She will lead a normal life. Tears ran down Bill Clinton's ears. I met him twice after that. He says, "I have not forgotten that incident." Then he said, "Dr. Reddy, we must do the world must do what you are doing so that people in remote places can benefit of high-tech medicine." So what have we done? We have, when Abdul Kalam promised the South African countries telemedicine for 50 countries, they gave connection back to AIMS, Apollo, and the Trivandrum hospital. But we were giving those concerts. Now we have about 70 countries connected with 250 connectivity. But within the country, number one, we are doing almost 1,000 telemedicine consults a day. And second, government of India, because they have laid the cable to the last mile to 60,000 villages on a single day. The minister gave, I was at the function, the minister said, "Dr. Reddy, you have done a great work. We installed in the high places in Uttarakhand and Himachala, 40,000 feet, telemedicine, no doctor there. Our doctors from our emergency advised what to do for patients who come there." So seeing that, he said, "Now why don't you do for the 60,000 villages, give a telemedicine advice?" So in the beginning,
It's possible.
we were very happy when he gave that.
Telemedicine possible now. Before Kaveri, Doctor, before Kaveri asks the last question, I'll ask the question. What do you see? Have we reached the peak in COVID, or we are going to have big numbers again, creating fear in the minds of the people again and again? How to remove that?
I think unless a vaccine comes, you can never cure the disease. And again, for India, the vaccine.
South Korea has gone down almost zero. So why can't it happen here?
No, I think that's the healthcare system. 10 years ago, they totally altered it. Something like the NHS, but it's better than NHS. So they had a very good system. They had approach for people. So they were dependent on, people were dependent on their healthcare system. So they listened to whatever they said, so they could get that result. But it didn't happen in US. It didn't happen in any other European country. So in India, again, our problem is we are ahead of them, but the people who are traveling without knowing that they have disease, and we coming into contact without knowing somebody has the disease, without taking these precautions, is still a major concern. So we need to solve that problem before we get over it.
Is the peak over or not, doctor? Peak is over or not?
I think they are expecting peak as October. Since I am not seeing anything down, I can't say the curve is flattened down. So,
It's unlikely to flatten in the future.
Right.
go by the
Doctor,
statistics who are saying probably October is the peak.
Yeah.
They moved it from July to October.
Doctor, just two quick questions. You said the lockdown had been successful and we were in time. Do you think the migrant crisis could have been handled better? Because when this infection is now going into the villages, that will be the real challenge. How could we have handled that issue better?
I think that is the problem. The real problem that we now have is them. Because lockdown helped people, but lockdown did not help the migrant people.
Right.
They probably aggravated the situation.
They were just abandoned.
So I think that was a big mistake.
So how can that be resolved now? Is it too late?
I think more and more testing. That's the only
Right.
way. We should
Right.
test it. I continuously must test the maximum numbers possible. And everybody, private healthcare and government, they were offered on in some states, they said private healthcare can do. ICMR gave a permission. Then some states said, no, you can't do it. Now they are saying you do everywhere. So I think everybody should participate in this.
Mm. And doctor, just one last thing. What is the one thing that you'd like to see change in your lifetime to cope with the increasing probability of viruses like COVID happening almost every year, as people are suggesting?
I think if you ask me to say what is the one thing which I would like to see,
Yeah.
to see that India should be proud to move away from curing disease from preventing disease.
Right.
Oh.
Should move
Prevention the best. Prevention the best cure.
that prevention is the best cure because you save costs and you earn more money because of that productivity.
Right.
It's been estimated saying if in a corporate, if an individual is healthcare is taken care of and you spend 1 rupee, your return is 12 rupees.
Right.
So this is a wonderful thing. And even for the country, they said it increases 15% of GDP if the people are happy. So I think the preventive medicine should take a tremendous thing. This is why they did a Ayushman Bharat, and if only the government of India implements 150,000 wellness centers,
Right.
it'll totally translate the health of Indians.
And do you feel the wellness centers should be in the private sector or in the public sector?
In both. I think they have opened it now, but they're asking Andhra. So they have given us some centers. Some states have given some centers for us to manage their centers.
Right.
I think there should not, the word private and public should go.
Right.
We should have one meaning. We should be able to give our people good health. And that good health is preventive.
At a good cost, doctor. At a reasonable cost. That's the most important thing as well, right?
I don't know if you ever asked to check to your room, what is the cost of your room?
Thank you very much, doctor. It was a pleasure to listen to you. We learned so much, and all the best to you. And may you climb many more mountains and open many more Apollos in India and the world. Thank you.
Thank you.
And more preventive centers.
Yes.
Thank you. Thank you.
That's why this one, because I have prepared, as I said, the warning that was given, the gun series will be cause 80% of the deaths.
Right.
So I was preparing myself just before this COVID came that I announced saying we'll launch this program called the Pro Health.
Right.
Pro Health is out of our 22,000 cases, the artificial intelligence. We got a company from UK.
Right.
We called a global bid for artificial intelligence. And finally, a company called DXC from UK has been selected. But their thing is to see how we can improve the technology in detecting people. So how can we read an X-ray better,
Right.
pathology slide better? And in this case, how do we do with the 22,000 data? How can we use the data to make a personalized health checkup data? This is what they have given. The first thing they have delivered is this. Second thing they are delivering is from the time 24/7 call, the moment you answer the call, and if you need help, they will connect you through. They'll connect you to a hospital or a clinic and to the doctor, and your care is given by them, and their care also is monitored by the 24/7 through this artificial intelligence. It's going a lot, I think. Automation is going to make tremendous.
Right.
First automation is we have put one on. When you walk into Apollo, there is a robot standing there. It says, "Hello, good morning, good afternoon. What's your name? What's your number?" If you don't have a number, it gives you a number. Then it puts it. Have you got fever? If you say no, still it put that electronic. This one takes the temperature and asks, saying, "Have you got cold? Have you got cough? Have you sneezed? Have you got throat pain?" All of these symptoms. Then diverts you to this. And then all these are automatically printed.
Right.
The answers you are given are automatically printed. It comes out as a slip. You just take the slip and go to the counter, and they know exactly where you should go. So I think
Thank you,
we
doctor.
started using this automation. This is where India should be.
Right.
Because we have the power, and I believe that Indians are intelligent, and we're second to none. But we had that saying, can we do it?
Yeah.
We can do it.
We can do it. Thank you.
Yes, we will do it.
Thank you, Professor. Thank you.
Thank you, Doctor. You're a visionary, and we're really proud to have you. Thank you.
Thank you so much. Thank you.